I really want to take the next few minutes to talk about how we can build up the pharmaceutical sector within Africa, the domestic pharmaceutical sector. And I came across one statistic when I was prepping for this session, honestly, which startled me, and I wanted to share that with you all. If you look at Africa, India, and China, we're talking about populations of over 1 billion people, right? 1.2, 1.4 billion people. India has 10,000 drug manufacturers for its 1.2, 1.3 billion people. China has 5,000. Obviously, I'm going to say Africa is a lot less. Any idea how many drug manufacturers there are in Africa to serve over 1 billion people? Sorry, how many? 100. You're really pessimistic. Anybody else? Any idea? You want to throw out a number? Okay, show of hands. Below 5,000 or above 5,000? Below 3,000? Below 3,000? Below 1,000? Okay, 375, right. So that's really, really, really low. There's a lot of work to be done. And it's no wonder then, right, that you think Africa imports most of its medicines, and depending which part of Africa we are importing anywhere between 70 to 90% of the medicines are imported into Africa. So against this backdrop, Steve, let me begin with you. What do you think has been the biggest learning for Africa from the pandemic?
Yeah, I mean, the biggest learning, first of all, thank you for having us. The biggest learning for us in Africa is you need to have your own supplies to be responsive, to be able to plan. But the biggest lesson, I suppose, is if you're overly reliant on other countries, other partners for your vaccines, you're always at the back of the queue, right? So, as you said, a population of 1.2 billion, to be importing up to 90%, 99% of your vaccines, it's very difficult for you to assure your populations of health security. So you can't have the health security that other parts of the world enjoy.
Absolutely. I mean, Sarmad, do you want to add to that? What, from your point of view, from Standard Chartered, which of course is one of the sponsors of this event, from Standard Chartered's point of view, what was your biggest lesson or learning from the pandemic?
Thank you, Mallika. To start with, I'm an optimist. So, and there are some green shoots over there. I'm sure you and some of the other colleagues in the room will be familiar with some good work being done by South African pharma company Aspen with Johnson's, right? Limited in scope and didn't take off as widely, as prolific as Pfizer and Moderna, but good beginning. But data you mentioned in starting the conversation is startling. I saw the same data and I was shocked.
Right.
I think, yeah, and I'll come to the work Stand Chart has done. I'll briefly touch upon it. I think the overall challenge specific to this point, which feeds into some of the other points when you talk about the trade corridors Africa has with the world, and the Africa Free Trade Agreement, we'll come to that, is the same challenge where Africa is reliant on importing from abroad.
Right.
In the most remarkable and significant way. And that has been manifest in this crisis. Now, thank God, the pandemic didn't affect Africa as badly as affected some of the other parts of the world. We're quite blessed with that and may remain that way. But the challenge is the infrastructure in terms of technology, healthcare, support base in Africa is really weak, right? And the backbone to support that infrastructure is not there. So commenting very briefly on Stand Chart, we were part of a number of concessional financing facility. One was specific to vaccine procurement, acquisition and distribution, where we partnered up with AfriExim, a partner in DFI in Africa. And the other one was a global program where we came up with a $1 billion concessional financing, and overall Africa Middle East contribution from that facility was around $300 million, where we went out and gave out concessional funding at our cost to companies and businesses who were helping with the pandemic, with PPE, with vaccination, with all kinds of the pandemic support infrastructure.
You know, one thing you mentioned, and again, that surprised me, and we talked about this yesterday briefly, the Aspen Pharmacare facility that's opened in South Africa, which is to manufacture Johnson & Johnson vaccines. I've been reading reports, you said it hasn't taken off. I've been reading reports, there hasn't been a single order. Why, Steve? Why do you think that might be the case?
Well, I mean, I think it would be difficult to answer the why without speculating. So I'll try not to speculate. But I think just two things I'd want to mention is we would want to see partners support manufacturers within the continent, especially the partners that are supplying the same vaccines to the continent. So that's the first thing. The second thing is the ecosystem. We have to look at manufacturing as part of a wider health ecosystem.
Correct.
So the science is just the beginning. You need to be able to move the science to the people that need it the most.
So the ecosystem, what you said, the backbone, we need that, right? What do you think needs to be the first thing to address? I mean, there are so many things. You said science is just the beginning. From your point of view, what's the first stepping stone?
So a couple of things, Mallika, in no particular order. And the order I state may not be the right order, but for me, technology transfer.
Yeah.
See, when you look at Africa, the challenge today is Africa exports a lot of raw products and imports finished goods, right? And that's the backbone of the challenge, right? Where they're exporting crude and importing refined products. They're exporting copper and they're importing finished products, from cars to everything else,
Right.
from cables. And that is, to me, the genesis, basic core ingredient which needs fixing. Now, there are good steps in terms of the Africa Free Trade Agreement. And if you look at, just to throw out some of the numbers, 2019 data, Africa imported roughly 600 billion, thereabouts, across the continent. 12% of that import was intra-Africa. That's the other thing.
Intra-Africa.
Intra-Africa,
okay. Right.
only
okay.
12%.
Right.
So one country, the biggest country, or one sector, the biggest sector, the car, after oil and gas, the biggest importation was cars. Africa imported cars worth $20 billion, $20 billion US dollars, 4 billion in the case of Nigeria alone. And the local component was 3%.
Really?
Yeah.
Yeah.
So this is what I'm talking about. You pick out any country, I can give a number of examples. Oil is being exported out by a number of oil exporting countries, raw crude oil, and refined finished products are importing in. So a number of countries, not to name names, are not seeing the upside that we have seen in oil and gas prices over the last couple of years to the same dimension, because the big spike is in the refined products and they're not getting the upside, right? Or to the extent they are getting the upside in the crude product export, they have to pay back most, if not all, if not more than all, in the case of when they import back the refined product, right? So that is the challenge that needs to be addressed. I think a couple of other points, and stop me if you think I'm speaking too long. I think technology transfer, which was my first point. The second is intra-Africa trade. Now, the components for intra-Africa trade to flourish. And there are bureaucratic components and there are actual concerns. A lot of the African governments take tariffs from trade, so they should, right? But on margin, the system needs to evolve and develop to a level where the bleed out from the import compensates for the tariffs that they are getting, right? That requires cooperation, that requires trust, and that requires working together with the partners across the 51 African countries and the global trade partners. The third component is the one where we as a bank, Standard Chartered, are quite active, is the infrastructure bit.
Yeah.
The overall, for technology transfer, you need help from the developed countries, right? The G7, G20, plus India, China, the more sophisticated economies, whether you're talking pharma, whether you're talking power, you are talking sustainable energy, whatever else you have. So there is the technology transfer component, which you cannot deny. But in addition to the technology transfer, you need power on the ground.
Yes, of course.
To run these industry,
Yeah.
right? You need a digital backbone, infrastructure, Wi-Fi, telecom sophistication to connect to the cloud, right? To connect to the global centers. So that requires investment dollars, and that requires infrastructure investment. We're delighted we are contributing and playing our share, but that needs to multiply, raise to the power 20, in my view. The third thing is, and there are good examples, so we are delighted that Dangote refinery, as and when it comes online towards the end of this year or early next year, whenever the timeline is, will address the first point I was mentioning, the Africa exports crude and imports refined. So once you have Dangote refinery up and running,
Yeah.
they will be refining their own crude and not only using in the domestic market, which is the biggest market in Nigeria, but exporting to other countries across. But the last point, and I'll finish over there, is that the infrastructure to move goods across borders needs to be developed. The flight connectivity from one country to another needs to improve. In some cases, not all the cases, you need to go to a third hub and then come back to a neighboring country.
Correct.
A number
It's
of
not
examples,
direct,
more than
yeah.
one I can quote. So those would be the kind of things when you talk about the broader infrastructure ecosystem, would be power, would be digital communications, and would be the road network, the bridges, the rails, and the safety and security to be able to use that infrastructure safely, securely.
Correct. It all creates that ecosystem. And Steve, yesterday when we chatted, you said something very interesting. You said for Africa to not be at the behest of the West, you know, yes, we have to make our own medicines. And you wish during the pandemic that one of the Western companies had perhaps shared their recipe.
Absolutely.
So that you all could make your own vaccines.
Absolutely.
But without this infrastructure in place that Sarmad has just pointed out, would Africa have actually been able to make those vaccines even if you were given the recipe?
Absolutely. I mean, if you just look in the last few months, the information that's coming out of South Africa and the research work that's been done by researchers in South Africa to replicate Moderna's mRNA vaccine, it shows that the capacity and capabilities is there. The question is our partners, willing to help accelerate that process? And this is why, for a long time, we've been calling for companies and the West to share IPs and to share the know-how and technology to give Africa a chance to be self-sustaining. So to answer your question, 1,000%, I think Africa is in a position to do so. Africa needs the support, and the conversation has already progressed. So if you look at what the AU has put together as a strategy to produce up to 60% of its own vaccine needs within the continent, the framework is there. It means more investment in R&D, more investment in capabilities, better regulation, better sharing across the countries, as you say, better trade policies. So it's all there. So the bigger question is, are partners who've partnered with us for many years going to come on board and help accelerate that process? So that's the fundamental piece. The second piece, to add to the points that were being made just now, is the wider ecosystem. So you've got infrastructure, you've got the supply chain, but you also need the health workforce. You need, health workers that are trained, that are capacitated, that are supported, that are incentivized to administer the vaccines. And then you also need communities that are mobilized and have the information so that they present themselves when these supplies are available. So I think it's a challenge to look at manufacturing in isolation. I think we need to take a step back and evaluate the entire ecosystem.
So you're saying that even if you had got the recipe from the West or from other companies, you all would have been able to make the vaccines in Africa. You're 1,000% sure you would have been able to do that. I guess the next question would be, if you didn't get the recipe, you need to reach a stage where you can create the recipe yourself, right? Yeah. So you're not dependent on other countries to share the secret sauce.
Yeah.
What do you need for that? Are we looking at huge investments in R&D, education, prevent the brain drain?
Yeah.
So talk to me about that.
Yeah, absolutely. I mean, so again, to your previous question, my optimism is driven by, the evidence. We've seen the work that's happened in South Africa, being able to replicate Moderna's vaccine. So if that's possible without Moderna's involvement, then that demonstrates that actually with a bit of support, collectively, that process can be accelerated. And to your what was the question you just asked?
Just saying that, we need to reach the stage where you
Right.
can create the recipe yourself. Yeah. So we need more investment in R&D, in research.
Yeah,
That's really
absolutely. Absolutely. I think, ultimately it's also a supply and demand question,
Yes.
right? So you do have players that want to come into the space, but perhaps are slightly cautious about the return on investment. Research and R&D is expensive. So yes, we want to invest in these areas, but we need to make sure that the market is there. We need to provide collectively as Africa that assurance that, to manufacturers that if you make this investment, there is a market for you. And that means pooling mechanisms, pooling procurement mechanism, but it also means partners that supply largely the continent with vaccines and medicines to really tap into that African market as well.
Sarmad, I want to talk to you about human capital. I mean, obviously, a healthier population means, and we're not just talking about medicines and vaccines for COVID, we're talking about the pharmaceutical industry as a whole. So a healthier population means a healthier workforce, which then, of course, will have a trigger effect and help economic output, right? So talk to me about the importance of human capital and how developing a local pharmaceutical industry can actually help the GDP.
Well, listen, I think, Mallika, it is existential in my view. And also, if I would to expand the scope of the question, I think it goes beyond the pharmaceutical industry into every facet of human life. It's all about human capital, right? My business, our business, the business of banking, the business of trade, finance, government, everything. It's existential to have the right framework. It's as important as safety and security and education. The next one is to have the right ingredients, to have develop people who are healthy, who are secure, and who have the right technical educational background to be able to support the growth of the economies and contribute to every segment, every facet of the country, of the economy they are in.
I just want to quickly go back to free trade. It's been on my mind that, you spoke about it, and I think that's absolutely important. So, Steve, from your point of view, how much of a game changer will that be to allow sort of smaller pharmaceutical companies manufacturing medicines in Africa by having that free trade agreement? How much of a game changer will that be for those companies who want to achieve scale? Because it's not worth it if you're not going to have a chance to achieve scale, right?
Exactly, but I think you've touched on it. It is an incentive. It's an incentive because it means the environment is enabling. Ultimately, what it tells them is, if there's a market for your product, but not only that, it means that the regulation and the policies will be conducive for you to do business. So it's a compelling case for manufacturers that perhaps have been discouraged previously. And this is why we also call on partners that supply the vaccines and the medicines to the continent largely to tap into that market. I think that's a significant part of it, because you do have countries that are still reliant on these donations, whether you're thinking Gavi as a vaccine alliance. So if Gavi taps into that market, it's really encouraging for the players within the continent.
This awareness and realization that Africa needs to be manufacturing its own medicines. This isn't new. We've been talking about this actually for decades. But do you think the pandemic is a turning point? And do you think we're actually going to see a difference being made now? Steve, I'll go to you first, and Sarmad, I'll come to you for the last word after this.
Yeah, absolutely. I think what the last 2.5 years have shown Africa is, yeah, you cannot have political security, economic security without health security. I think that's been significantly clear. I think it's also been very clear that you cannot be over-reliant on partners, on goodwill for you to deliver on health security. So I think that is a turning point, and we've seen a lot of players and stakeholders and governments collaborate, and come together and really develop a framework that's clear, that stipulates this is where we want to go. We want to be able to produce at least 60% of our own vaccines by this year, and this is how we get there. This is how we get there. This is what we expect from our other partners and stakeholders. What we've seen as Amref, an African-led organization that works across many African communities to address the barriers that keep communities from accessing good health, is also the idea that you do need to have a resilient health system. You do need to have that supported workforce. You need to have all these things in place for your science to be effective.
Sarmad, last word from you. From what you're hearing and seeing on the ground in Africa, are we at a turning point? Is the pandemic, going to be what it takes to actually really create that change in Africa and really give the local the pharmaceutical industry, the impetus to change?
Most certainly, I think, and I would again add to the comment which I said before on a couple of themes. I think the entire world, Mallika, is in quite a unique place in terms of lessons from the pandemic. We have seen over the last 2.5 years developments which are black swan events. Honestly, no one of us imagined, I didn't, that you will see the kind of backlogs that we have seen in the last 2.5 years, the kind of shortages you have seen in the last 2.5 years, the lump up or backlog and delay at the ports you have seen. So I think it's a lesson for the entire world. In every sector, in every segment, pharmaceutical is existential from a healthcare perspective. So absolutely, there are lessons to be learned by everybody.
It's a wake-up call.
It's a wake-up call, and it's a wake-up call. And I see a lot of green shoots, a lot of positive takeaways. We've passed through a very tough 2.5 years. The world is coming out, and with a lot of good lessons.
Well, that's a good note to end on. Green shoots of recovery all around.
Thank you.
Sarmad,
Asante sana.
Thank you very much. Thank you.